Hello friends, in today's lecture we will be talking about some of the important cranial nerves. We will not discuss all the cranial nerves but only the selected cranial nerves which are high yield for the exam like Neet-Pg, Fmge, DNB and all. Okay, so let's get started. So as we know there are 12 cranial nerves. We all know all these things, so I'll not be going in details about this. So first start with trochlear nerve, which is the largest intercranial has the largest intercranial course and the thinnest cranial nerve. It has a dorsal origin and contralateral, and it has a contralateral origin also, and it's the most slender, having the least amount of fibers. See here in this diagram you can see the nerve has a dorsal origin and it has a contralateral origin as well. Next is trigeminal nerve. It is the thickest cranial nerve and its thickest branch is the mandibular branch. It has three branches: V1, that is cranial nerve 5, and the branch 1, that is supraorbital, it comes out from the supraorbital fissure; V2, which comes out from the foramen rotundum; and V3, which comes out from the foramen oval. Okay, here you can see it's this diagram is very nice diagram which explains all three orbital fissure and how the branches comes out. And here it's very important that petrous temporal bone you can see here. Next, abducens nerve. It's the longest subarachnoid course. It has the longest subarachnoid course. It's very important because whenever there is raised IC intracranial pressure, it's the commonest nerve to be involved in the spinal anesthesia because it has a subarachnoid course. Here you can see the abducens nerve, which is the longest course through the subarachnoid space where we keep the spinal anesthesia. Next is facial nerve, cranial nerve 7. It has the longest interosseous route. So listen, if the nerve, if it is asked in the question that which is the longest nerve, cranial nerve, that is vagus nerve. But if it is asked which is the longest osseous route, then it's facial nerve. So most common cranial nerve involved in trauma is facial nerve. As we know that most commonly trauma occurs in the middle cranial fossa, so if it is in the middle cranial fossa, then most commonly nerve which is going to be injured is the facial nerve. The first branch of facial nerve is greater petrosal nerve and it comes out through stylomastoid foramen. So here you can see stylomastoid foramen just before the posterior to the styloid process is the stylomastoid foramen. Next is glossopharyngeal nerve. Glossopharyngeal nerve, it is the main nerve for the secretomotor parotid gland. It's just posterior to the parotid gland, and it embeds the stylopharyngeus muscle, and if it has an injury you can see the nasal twang voice. If you hear any nasal twang voice, that means like if the question gives the term like nasal twang voice, then you can mark as glossopharyngeal nerve. So here you can see the glossopharyngeal nerve crosses stylopharyngeus muscle. Vagus nerve, the next nerve. These are very important. The others nerve: Minderweg nerve, Arnold nerve, and Oerlemann nerve. It is the longest nerve overall. In stomach, the nerve it divides on the neck of the stomach, like in the lower part of the esophagus. It divides into two, anterior and posterior part. The anterior nerve is called the nerve to letter J, and the posterior nerve is called criminal nerve of Grassi. So for the vocal cord palsy, it's important because recurrent laryngeal nerve comes from the vagus nerve only. See here, the criminal nerve of Grassi is the posterior part, and the anterior and posterior nerve of letter J. So here in the last part of this video we'll be talking about the ganglion names. So cranial nerve 5, trigeminal nerve, its ganglion is the Gisserian ganglion. Cranial nerve 7, facial nerve, its origin it's from the geniculate ganglion. Cranial nerve 9, which is the glossopharyngeal nerve, it comes from the otic ganglion. And cranial nerve 10, which is from the nodos ganglion. So these all points are very important for the all postgraduate exams like DNB, Neet-Pg and Fmge exam. So these all are from my side, my according to my view of importance, guys. So thank you so much. Support us by like, comment, share and subscribe. You are watching MD Medicine. Thanks for watching.